Have you ever heard of something called pendulation? Well, let's check it out in this video on how to deal with your pain. Let's do this. Hey, Dr. Les here with the Mindfulness Channel, a channel focused on brain science, mindfulness, and acceptance and commitment therapy, providing you information and skills to help you transform your mind so you can transform your life to be the best you. So let's get started here. What is pendulation? Well, pendulation is also known as looping. It involves going back and forth between something pleasant and something unpleasant, such as discomforting physical pain or anxiety or any sort of sensation you don't want to experience. Because pendulation creates a new brain pathway to help you shift between a defensive nervous system and a state of calmness. Doing so will help you slowly and gently expose you to what you're resisting, again, such as physical discomfort or even emotional distress that's showing up in your body. When you do pendulation, it helps retune the nervous system towards a state of homeostasis. It is nearly impossible to heal from depression, anxiety, chronic pain, or any sort of chronic medical condition when your nervous system is constantly in a state of defensiveness. So pendulation is just a great intervention to send a clear message to your nervous system, that is your brain and body, that you're safe, which in turn you may start to experience less intensity to your physical pain, your anxiety, and any other somatic sensation that shows up that's quite activating. It's really intriguing. Whatever we resist will often persist. The way the brain and body, again, that's the nervous system, is created is that when we push something away that's difficult, such as maybe a thought, emotion, or even a physical sensation we don't want to experience, the brain encodes that. So the next time when you feel this unusual sensory experience or sensations in your body, again, whether that's an emotion or a physical sensation, it sends a message to the brain, to the body, that I'm not safe. So that is why pendulation is very important, even if you're feeling anxiety or you have some sort of chronic pain. Learning to engage in pendulation will help dial the nervous system down and retrain, reshape, retune the nervous system. So let's give this a try. Ready? In this exercise, you may do it sitting or lying down. So when you're ready, go ahead and take 3 full gentle breaths, pausing at the top of each breath and breathing out through your softly pursed lips. Just feel that sinking, melting, letting go as you exhale. Taking your time and just feeling that sinking, melting, letting go sensation. Now, focus on where you feel the breath in the body. Do you notice the breath at the nose, or do you notice the breath at the belly? If you notice the breath at the nose, make a soft mental note of in as you breathe in, and as you breathe out, quietly make a soft mental note of out. In, out. Or if you notice the breath at the belly, go ahead and whisper belly rising as you breathe in, and belly falling as you breathe out. Do that for about 3 to 5 breaths. And when you're ready, locate the area in your body that you're holding on to tension. This could be your low back, your neck. This could be your chest, your abdomen. Wherever you notice the physical discomfort, go ahead and locate it now. And once you've located the area you want to work on, notice the size and the shape of that discomfort. It is as if you're penciling in the area. Is it the size of a grapefruit, the size of a baseball, golf ball? What size is it? So notice the size and shape and even the qualities. Is it sharp, aching, throbbing, burning? Just make a mental note of what it is. And once you've done that, now shift into the discomfort, the sensations you're feeling. Try to locate the very middle of it. Try to go to the very, very middle of it. And once you locate that, imagine a tiny hole. And as you breathe in, I want you to feel a cool sensation entering into that hole. And as you breathe out, I want you to feel the warm air leaving. So again, locating the area, the size, the description, the quality of the symptoms, and then going to the very middle of it and imagining a tiny hole. And as you breathe in, imagine cool air entering. And as you breathe out, feel the warm air leaving. Do that for about 3 to 5 breaths. Again, just focusing on that cool sensation as it enters into that area. The warm air leaving that area. Do not rush this, taking your time. Again, just focusing on the sensations of the coolness and the warmth leaving. And when you're done, go ahead and release your attention there. Coming back to where you feel the breath in the body. May that be at the nose or your belly. Going back to your mental notes that you were making. In, out, if you notice it at the nose. Or belly rising, belly falling, if you notice the breath at the belly. Just continue to feel the flow and sensation of your breath while you make those soft mental notes. And again, just 3 to 5 breaths. And when you're ready, going back to the same area where you had the discomfort, going back to the very middle of it and breathing in cool air and warm air as you breathe out. Just taking your time, not rushing. 3 to 5 breaths. Just allowing it to unfold and unwind. Good. Now going back to where you feel the breath in the body. Once again, if you notice it at the nose, using a soft mental note of in as you breathe in and out as you breathe out. Or if it's your belly, belly rising, belly falling, soft mental note, just feeling the flow and sensations. Making those soft mental notes. And when you're ready, gently open your eyes. So go ahead and use this intervention anytime you feel a very intense bodily sensation that shows up. You do not have to overdo this. Try it a few times throughout the day. Hey folks, that's a wrap. Hopefully you enjoyed the pendulation intervention. Do give it a try. Please do subscribe. Share this video with someone who may benefit from this, and also would love to hear from you. Until next time, I'm Dr. Les. Have an awesome day.